Good evening. This is Dr. Bhupesh from Dr. BKM Institutes. And hi, doctors. Hi, everyone. So today we have got this topic. Please remember that in original exam, you will not be getting this patient task. So you will be getting only doctor's tasks. So you have to be self-dependent. That is what I am telling you again and again. Please be self-dependent. Don't wait that examiner will do this and that. It is not right to wait for the examiner. So I will tell you how to do that so that it makes more sense to all of us. And I'm just going to speak this speaking topic. So in OET role play, in OET exam, you would be getting this much only. That's it. So this is the only part you will be getting. So you say, as there is a situation where a parent presented 2 hours ago at the emergency department with her 4-year-old son. The boy had a 36-hour history of recurrent vomiting and stomach pain, which was diagnosed as viral gastroenteritis. He was given oral rehydration fluids and observed for 2 hours. So he came to you 2 hours ago. You have given him rehydration fluids and observed for 2 hours. You have just told the parent that it is safe to discharge him. The parent seems anxious. So the concern is that parent is anxious when you will tell the parent that you can go home. So he is anxious. So there would be many concerns. Explain viral gastroenteritis and irritation of the stomach. Give information about how gastroenteritis is spread. Contact with an infected person. Shaking hands, contaminated foods. Resist request to keep the patient in hospital. So you have to resist. You should say oral rehydration typically is usually effective. Use advice on hydration and appropriate clear fluids. Water down unsweetened fruit juice. Electrolyte hydration preparations such as Gastrolite. Convince the parent that it is safe to take his or son home. Advise when to seek medical advice. Signs of severe dehydration, extreme thirst, lethargy, irritable, plain sunken eyes. Okay. So I would execute. Good morning. I'm Dr. Bhupesh and I'm doctor for your 4-year-old son. So I would like to say that we have given him rehydration of fluids for 2 hours and he seems to be very okay now. So it is the time that we can give him the discharge. So you would be glad to know that your son is going to be discharged. Well, doctor, how could you say that my son is getting discharged? Like, I am really anxious, he has been having recurrent vomiting, stomach pain, and it was like for 3 days. And now you are saying that only after 2 hours you want him to get discharged. See, I'm not saying it by myself. It is according to my expertise that your son is absolutely fine now. As you came here, just because you came here because he was having 36-hour history of recurrent vomiting and stomach pain, and it was diagnosed as viral gastroenteritis. So I would like to explain you this condition. It is an irritation of stomach or intestines due to the viral infection. So basically your son caught a viral infection, and you have to be cautious about it, that it can spread through contact with the vomited feces of an infected person. The example of this is like shaking hands, contaminated foods, or other objects. So basically, it can happen from anywhere when we shake hands with a person who is having this problem, and sometimes through the contaminated foods. So your son got a viral infection, and that is known as viral gastroenteritis. So please do not get dependent upon the examiner that he will speak. You should be able to explain everything by making linkers. So as your son came with a history of 36-hour recurrent vomiting and stomach pain, so he was diagnosed with viral gastroenteritis. Let me explain you what is viral gastroenteritis. It is an irritation of stomach or intestine. So you use your word. Let me explain you. Also, I would like to give you some information that how gastroenteritis is spread. It basically spreads through contact with the vomiting or the feces of an infected person, such as while shaking hands or with the contaminated foods and objects. It may happen. But doctor, I think he should stay in the hospital. I'm really worried. Well, I do understand your concern, and being a parent, obviously it is very hard to see your son in this kind of condition. But let me tell you that your son is better now, as we have given him hydration, so he is much better, and oral rehydration is very effective, so you don't have to worry. I also would like to advise you on hydration and appropriate fluids that should be given at home. So the kind of the fluids which should be given is watered down unsweetened fruit juice. So the fruits which are not very sweet in nature, you should be giving those kind of juices and he should take it sip by sip. Or even the electrolyte hydration preparations such as Gastrolite is very effective. So don't worry, we will tell you the formulas of all these things and it would be very effective. Is it okay? Have you understood everything? Do you want me to explain anything? No, doctor, I have understood. Okay, that's great that you have understood everything. And I can understand that you want him to stay in the hospital. But I would like to reassure you that it is very safe to take your son back home. And also, I would like to note these things if there are any kind of medical signs like signs of severe dehydration, or if he feels extremely thirsty or feels lethargic, irritable, or might have pale or sunken eyes, then in these kind of emergencies you must contact us immediately. So I'm giving you a leaflet which contains all the information about viral gastroenteritis and how it can spread. So please read this leaflet, it would be beneficial for you. And at the same time, it also contains the instruction that you should follow at your home. And if you see any sign which is of severe dehydration, do contact us on the number given below at the leaflet. So this is how you should do the complete task. And in the last, you should say, I would like to reassure you. So these things are very important. And please, if you will see, I have not waited for the examiner. I have taken the burden of whole task on myself. That is how this task should be executed by you as well. So I would unmute you to ask any doubts if you may have any kind of doubts. So I should ask you first. So I'm going to unmute you. Please, you can ask me any doubts that you may have. Any doubts, please. I have unmuted you. So please carry the task by yourself. Don't be dependent upon anybody. Just be free flowing. Any questions, please? Any kind of question. So should I consider that you all have understood it nicely?
Yes, sir.
Okay, then I'm taking it positively and still will ask you doubts even after stopping the recording. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.